Welcome back all of you to Mock Test Explanation Series, Part 17. First question. A patient was brought to ED with complaints of chest pain from last 1 hour. Which test is done to detect the myocardial infarction? Option A, serum electrolyte. Option B, ABG. Option C, CBC. Option D, troponin TV. Let us go to the right answer. The right answer is option D, troponin T. Here, for myocardial infarction, the blood investigations are given here below. ECG, angiogram, all those kind of investigations are there, but here we are particularly mentioning about the blood investigations. Cardiac markers, troponin, a protein found in heart muscle that leaks into the blood during a heart attack. Troponin I, troponin T, these kind of troponins are elevated in MI. Creatinine kinase MB or CKMB, an isoenzyme of creatine kinase that reaches its peak at 10 hours after a heart attack. Then LDH levels also will be peaked after 72 hours and return to normal within 10 to 14 days. So, troponin, CPKMB, LDH, these kind of parameters are related to myocardial infarction. Next question. Accountable care organizations and other programs help doctors and other healthcare providers work together to deliver better care. This overview of the healthcare law was proposed on option A 2010, option B 2011, option C 2012 and option D 2030. Let us see the right answer. The right answer is option C 2012. Overview of Healthcare Law 2012. Accountable Care Organization, ACO, and other program help doctors and healthcare providers work together to deliver better care. ACOs are group of doctors, hospitals, and healthcare providers who come together voluntarily to give coordinated high-quality care to the Medicare. So here you can see the goal of ACO, better care, better cost, and better health. Next question. The planning approach in which budgets and project schedules that are designed for a specific purpose and time frame is called option A, contingency planning, option B, strategic planning, option C, fiscal planning, and option D, operational planning. These all are related to administration and research. Let us see the right answer. The right answer here is option C, fiscal planning. Contingency planning involves identifying the potential risk and developing alternative course of action to be implemented. So this is just like a plan B. We will say if plan A fails, plan B. So this is for the primary plan fails, then next plan. This is the contingency planning. Strategic planning is a long-term goal and objective. This is a high-level plan that define our organization in the long-term goal and objectives. Operational planning is the day-to-day planning. See, this is involving detailed day-to-day activities to execute strategic plans. And fiscal planning is the one it's focusing on managing an organization's finance and budget for a scheduled time. Let us go to some memory tips as well. Contingency planning, plan B if the primary plan fails. Strategic planning, long-term goals and objective, and operational planning, day-to-day activities. Fiscal planning is for finance and budget. Next question. Which of the psychiatric drug does not need any test dose before starting routine dose? Option A, haloperidol. Option B, risperidone. Option C, clozapine. Option D, quetiapine. Let us see the right answer. Right answer is option B, risperidone. So here the psychiatric drug which does not require test dose before starting routine dose is risperidone. Antipsychotic drugs are also called neuroleptic medicine. This is one of the important questions repeated. So be careful about this kind of points which I am mentioning with my previous experience in exams. Antipsychotics are otherwise called neuroleptic medicine. There is first generation, second generation, and third generation also is there. I will mention here first and second. First generation drugs are haloperidol and chlorpromazine. This is for dopamine blockage. It is blocking the dopamine receptors, first generation. Second generation drugs are clozapine and risperidone. This will block dopamine receptors as well as serotonin, SSI, selective serotonin uptake inhibitors. Then the first generation drugs are called typical antipsychotic drugs, and second generation is atypical antipsychotic drugs. Then haloperidol always have extra pyramidal syndrome risk, EPS risk, so it need monitoring. Clozapine, quetiapine also require careful monitoring and test dose. Risperidone is the comparatively safe, relatively low risk drug which can be given without a test dose. So risperidone is the right answer. Next question. A patient admitted in ward with the diagnosis of delirium, in first 24 to 48 hours, what nurse plan according to priority? So the planning according to priority, that is the key. Option A, orientation to person, place and environment. Option B, to restore bladder and bowel function. Option C, correct the wake and sleep cycle. And D is to improve the nutritional status. Let us see the right answer. The right answer is option A, orientation to person, place and environment. Here the priorities we will choose. It is obvious that to orient to person, place and environment is the first priority. Then all the other priorities. The first thing for especially a psychiatric person is he need to be oriented. Then all the other things can come like walk, sleep cycles, then nutritional status, bladder and bowel function, all those things, sleep pattern, everything will come. Next question. Adrenaline dose in anaphylactic shock is option A, 1:1000 0.5 ml. Option B, 1:10,000 0.5 ml. Option C, 1:1000 1 ml. Option D, 1:10,000 1 ml. Let us see the right answer here. The right answer is 1:1000 0.5 ml. In anaphylactic shock, intramuscular adrenaline 10 micrograms per kg or 0.01 ml per kg of 1:1000 maximum of 0.5 ml into lateral thigh is given. So 1:1000 0.5 ml is the right answer. It is given intramuscularly to the lateral thigh. And other adrenaline usage is in cardiac arrest. It is recommended dose for 1.0 mg of adrenaline, that is 10 ml of a 1:10,000 solution administered IV intravenously every 3 to 5 minutes during the resuscitation process. Next question. Normal eternal feedings are flushed with water to open blocked tube and is feeding. In which area it is done with air? Option A, NICU. Option B, operation unit. Option C, rehabilitation unit. At option D, critical care unit. Let us see the right answer. The right answer here is option A, NICU, Neonatal Intensive Care Unit. In the Neonatal Intensive Care Unit or NICU, enteral feedings are flushed with air instead of water to open the blocked tube. This is because newborns have a small gastric capacity and water would take up too much space and change their nutritional status. So we are using air instead of water to save the space. Next question. The role of medical surgical nurse that uses critical thinking, clinical judgment and the nursing process as a key tool for nursing practice is option A, practitioner role, option B, leadership role, option C, managerial role, and option D, research role. Let us go to the right answer straight away. The right answer is practitioner role, option A. Key aspect of nurse practitioner role is patient assessment, diagnosis and treatment. This is the main thing because normally in nursing it will not come, but here you have to diagnose and initiate the treatment as well. Patient education and collaboration is also there. So the clinical judgment, that is the diagnosis, critical thinking, all those are mainly coming in practitioner role of a nurse. Next question. Patient in emergency department diagnosed to have fluid and air present in lung. What is the above mentioned condition known as fluid and air? Option A, hemothorax. Option B, hydropneumothorax. Option C, hemopneumothorax. Option D, pneumothorax. Let us see the right answer. The right answer here is option B, hydropneumothorax. Let us see what is hydropneumothorax. It is the fluid plus air in pleural space. Hemothorax is blood in pleural space. Pneumothorax is air in pleural space. Hemopneumothorax is blood plus air in pleural space. Next question. Lignocaine and adrenaline not used for repair of injury to digitalis because option A, adrenaline causes vasoconstriction of blood vessels supplying digitalis. Option B, adrenaline decreases the effect of lignocaine. Option C, adrenaline causes systemic effect. Option D, adrenaline causes vasodilation, which may lead to increased bleeding. Let us see the right answer. The right answer is adrenaline causes vasoconstriction of blood vessels supplying digitalis. Lignocaine and adrenaline are not used for a repair of injuries to digitalis because the adrenaline combination will cause the vasoconstriction, which can lead to decreased blood flow to the delicate tissues of finger and potentially the tissue damage or necrosis can happen due to the lack of oxygen supply. Next question. Nurse on PICU advised to give 400 ml of fluid to be given on 8 hours. Drop factor is 60 drops per minute. Nurse will run the fluid at what flow rate? Option A, 13 drops per minute. Option B, 50 drops per minute. Option C, 17 drops per minute. And option D, 30 drops per minute. Let us see the right answer. Right answer is option B, 50 drops per minute. The drop factor 60 drops per minute, 400 ml in 8 hours. So 1 hour there should be 50 ml, that is 400 by 80. 50 ml should go in 1 hour to complete it in 8 hours. So fluid rate is 50 ml per hour. 50 ml per hour we will converting to the drop per minute, that is 50 into 60 is the drop factor and 60 is the minutes, hour to minute. So 50 drops per minute is the right answer. If you need any additional time for this kind of calculation or logical reasoning question, please pause the screen before you go to the answer because different people will need different time limit for calculation and all. I cannot hold more than 1 minute for a question because of the video length and limit. So please pause the screen and continue as per your requirement. Next question. All of the following are incorrect regarding stoma formation except option A, stoma is created near the bony prominence. Option B, stoma should be created away from bony prominence. Option C, stoma is created in lower abdomen in fatty region. Option D, stoma can be done anywhere. Here the right answer we will go, but before that I will tell you the strategy. Here you can see two options are contradictory. So most probably one of the option will be right because if two options are contradictory, one should be right. Then except is the negative word. So we have to see which is correct. So then the stoma can be anywhere also, can be a wrong option. So these all things you have to keep in your mind. So let us go to the right answer. The right answer is stoma should be created away from the body provenance. So this is the only thing is correct. All other options are incorrect. So this is, except this is incorrect, that means this is correct. So stoma is an opening of the body. You can see the stoma here in the stomach. It is in the upper part. Stoma site should be 5 cm away from skin fold, prior scar and body prominences. So it should be away, not the near place. It should not be created near bony prominence. In obese patients, stoma should be in upper abdomen. So option B is the right answer. Next question. Providing health education about the environmental hygiene to the community people is an example of option A, social communication, option B, structural communication, option C, therapeutic communication, and option D, formal communication. Let us go to the right answer straight away. The right answer is option B, structural communication. The different communications are social communication used to communicate normally in a social situation. For example, we are planning the weekend plan with friends. That is a social conversation or social communication. Just to understand and interact with the social norms. Structural communication is the instructional approach between author of instructional material and the student. So this is more like an education, like providing health education. Therapeutic communication is a specific type of communication used in healthcare professional to the patient, nurse-patient communication or doctor to patient. That is therapeutic communication. Formal communication is official communication within an organization. It is the official communication. Next question. ECG of the patient is showing ST depression, prominent U wave and inverted T wave. Which of the electrolyte imbalance is present here? 1. Potassium 2.2 milliequivalent per liter. Second, calcium 8.2 milliequivalent per liter. Option 3, magnesium 1.8 mg per dl. And option D, sodium 133 milliequivalent per liter. Here you need to know all the normal values for answering this kind of questions. Let us go to the right answer. Right answer is potassium 2.2 milliequivalent per liter. A normal potassium level is 3.5 and 5.2 milliequivalent. So here it is 2.2 it is written, so it is hypokalemia. So hypokalemia is featured with the prominent U wave, ST depression, inverted T wave, etc. You can see the features here. Just you have to know about hyperkalemia as well. I will mention hyperkalemia is with the tall peaked T waves with a narrow base and short QT interval that you can see here, tall T waves and all. So ECG features and hypokalemia is very important. Normal ranges of potassium, magnesium, all the electrolytes, etc. is also very important for the exams. Next question. Patient is undergoing blood transfusion and suddenly patient shows complaints of transfusion reaction. What will be the priority nursing intervention? Option A, stop the infusion and remove cannula. Option B, stop the infusion and flush with NS. Next one is complete the transfusion and administer injection avil. Last one is complete the transfusion and discard the bag. Let us straight away go to the right answer. The right answer is stop the infusion and flush with NS. Here you can see complete the transfusion and administer injection avil is not the ideal way, because any infusion or transfusion, when there is a reaction, the immediate thing is to stop. So this complete the transfusion is the wrong answer. Straight away you can eliminate this. Then these two, stop the infusion, these two are the right answer. So from this, most appropriate is first one, stop the infusion and remove the cannula. Remove the cannula is contraindicated here because we have to give medicines. Give medicines like emergency medicines or anti-allergic medicine for the transfusion reaction. So cannula should be kept intact. Flushing with saline is okay because blood will clot after some time. So flush the cannula, keep it ready for administering some emergency medicines if necessary. So this is the right answer. Next question. Nurse taking care of child who is having epilepsy. What nurse should do immediately? This is also an application level question. Option A, airway management and provide side-lying position. Option B, administer oxygen to child. Option C, do nothing and record the epilepsy types and duration. D, inform doctor about epilepsy and record in nurse's chart. Let us see the right answer. The right answer is option A, airway management and provide side-lying position. Here also priorities like ABC guidelines etc. will come. Airway management, ABC, airway is the highest priority. See, airway management and provide side-lying position will prevent aspiration and or airway blockage, all those kind of immediate life-threatening conditions. Administer oxygen if it is required only you can do, because if SpO2 and all significantly indicate that time you can start. Do nothing and record epilepsy type and duration is the absolute wrong answer. You have to do something in an emergency. Inform doctor about epilepsy and recording is also can be done, but that is not for an emergency phase. That can be done after you immediately done the ABC or airway immediate emergency management. Next question. Nurse asked in give 1 liter of normal saline at flow rate of 125 ml per hour. How much time it will take to complete this flow? This is a very simple question. Let us see the answers. Options and answer. Option A 8 hours, option B 6 hours, option C 10 hours, option D 12 hours. Let us go to the answer straight away. The right answer is, as you know, option A 8 hours. It's very simple, like total volume is 1 liter, that is converted into 1000 ml. Then flow rate is 125 ml per hour. So 125 ml should go in 1000 ml. So duration should be 1000 divided by 125. That is 8. That is 8 hours. Next question. The contraindication of induction of labor include the following except option A, placenta previa, option B, fetal macrosomia, option C, cold presentation, option D, cephalopelvic disproportion. Here you have to see the negative word very careful, except. So you have to select which is not the contraindication. Let us see the right answer. The right answer is fetal macrosomia is not the contraindication. It's the right answer, option B. Absolute contraindication for induction of labor is severe placenta previa, transverse or oblique fetal lie. Then relative contraindications are active genital herpes and high and floating fetal head. Other contraindications are cold presentation or prolapse, cephalopelvic disproportion, previous cesarean section, breech presentation, cervical cancer. You can see here, absolute is placenta previa. This is not the contraindication. So this is the contraindication, yes. Then fetal macrosomia is not in the list. This is not the contraindication. So except word is there. See, the negative word is here. So the answer will be fetal macrosomia, which is not a contraindication for this induction of labor. Cold presentation is mentioned here, as cephalopelvic disproportion is also present here. Next question. Glove papers are discarded in which biomedical waste dustbin? Option A, black dustbin, option B, red dustbin, option C, yellow dustbin, and option D, blue dustbin. Let us go to the right answer. The right answer is option A, black dustbin. Here, biomedical waste disposal according to different guidelines like JCA and NABH, then infection protocols of the hospital. So this will differ. You have to read the question. See, the note I will mention here first before going to the answer. In some protocol, black is cytotoxic, blue is recycle waste. So read the question and understand which guideline and choose the most appropriate answer. That's the best thing you can do, most appropriate. We can't fix the answer here because different protocol have slight variations. In general, black is for general waste, paper, thin plastic, etc. Yellow is for infectious waste like cotton infected with some wound or something like that. Then red is for the thick plastics like IV bottle, syringes, etc. So again, you have to see the protocol and select the most appropriate answer in this option. Here the most appropriate is black. Question 45. Patient with DVT is advised low molecular heparin. At which site nurse will administer this? Option A, subcutaneous, option B, IM, option C, oral, option D, IV. Let us see the right answer. The right answer is option A, subcutaneous. Low molecular weight heparin LMWH is administered by a subcutaneous route because bioavailable low molecular weight heparin has excellent bioavailability when given by subcutaneous injection. Which phase of the nurse-patient relationship focus to develop clarity about the patient's preconceptions and expectations of nurse and develop acceptance of each other and respond to people who can offer help? Option A, orientation phase. Option B, working phase. Option C, exploitation phase. And option D, termination phase. The right answer is working phase. Option B. Here the stages are mentioned in two way. Pre-orientation phase is nurse gather information and data. Orientation phase, nurse introduce themselves and establish the goals. Then working phase, the implementation of interventions collaboratively with the client to achieve established goals. All those main active phase is coming. Then termination phase is the final stage of relationship to summarize progress, discuss discharge plan and prepare the client to transition away from the therapeutic relationship. Next question. This is an logic reasoning question. Sheila said, Arun is the son of only brother of my mother. How is Sheila related to Arun? Option A, sister. Option B, brother. Option C, cousin. Option D, uncle. Let us see the right answer. The right answer is option C, cousin. This is logical reasoning. Steps you have to see. Arun is the son of the only brother of my mother. That is a statement by Sheila. So, Sheila has a mother and mother has only one brother. Sheila's maternal uncle. So, Sheila has mother. This is maternal uncle is the person. Then, Sheila's maternal uncle has a son, that is Arun. So, Arun is Sheila's uncle's son. That is Sheila's cousin. This is the way you have to analyze step by step. Don't jump into a conclusion. Step by step, you have to write the relations of each person, then link into final answer. Next question. Find the missing number. This is also logical reasoning. 12, 23, 44, 85, 166. So, what is next in this series? Option A, 320. Option B, 332. Option C, 327. Option D, 340. Let us see the right answer. The right answer is option 3, 327. Let us see the pattern. This is the reasoning IQ and finding the patterns. 12, 23, 44, 85, 166. 12 into 2 minus 1 is 23. So, next is coming like that. So, multiplied by 2, then add 1. 2 minus, add 1 to minus, like minus 1. Then here it is minus 2. Here 44 into 2 minus 3. 85 into 2 minus 4. Then obviously the next one will be 166 into 2 minus 5. So, adding 1 to minus, then all are multiplied by 2. So, here this is the answer 327. This is the right answer. Due to time constraint, I am just running fast. Please check this after pausing, and if you have any doubt, please ask in my comment box. Next question. Which of the following is not a member of BRICS? Option A, Brazil. Option B, China. Option C, India. Option D, Indonesia. This is a general awareness question. Let us go to the right answer. The right answer is option C, India. Sorry, Indonesia. It is the right. This is the wrong answer. Sorry for that. Indonesia is the right answer. Here you can see the countries. Brazil, Russia, India, China and South Africa are the countries, and the new members are Egypt, Ethiopia, Iran, Saudi Arabia and the UAE. These all are the new members. So, here I written here, this is a typing error only. Don't go to this answer. This is the Indonesia is the right answer. Brazil, China and India is the BRIC country members. And new members are also added here for your reference: Egypt, Ethiopia, Iran, Saudi Arabia and the UAE. Final question of this session. In which among the following situation we can observe elevation in jugular venous pressure? Option A, normal physical exam. Option B, conductive blocks. Option C, constrictive pericarditis. Option D, myocarditis. Let us see the right answer. The right answer is constrictive pericarditis. Here, constrictive pericarditis is a rare condition that occurs when the pericardium thickens and scar, limiting the heart's ability to pump blood.